Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about lead poisoning, and some changes coming in the state of Maryland. And our special guest is Lynn Phillips, a community health nurse with the Frederick County Health Department. Lynn, welcome. Thank you for joining us.
Thank you, Dr. Brookmeyer. It's my pleasure.
Well, let's jump right in. What is lead? Okay.
Lead is a soft gray-blue metal that occurs in nature. It is been around forever, especially due to industrialization. It does not degrade or decompose. Lead has absolutely no physiologic value to the human body, and it is a poison, especially to young children and also to adults.
Okay, so let's talk a little bit more about the children. So why are we concerned about childhood lead poisoning?
Okay. Children, especially young children who are just learning about their environment, they automatically put everything in their mouth. And if they live in an older home, they can quite possibly pick up lead paint chips and put them in their mouth because lead tastes sweet. And even if they're exposed to small amounts of lead paint chips or lead dust from construction or remodeling, that is also a hazard. Lead affects the developing nervous system of young children and can cause irreversible harm over time if not treated.
Oh, and result in damage to the brain, I hear you say irreversible.
Damage to the brain, learning disabilities, hearing problems, many different things that can occur.
Okay, all right, yeah, and I know that I've read recently about some of the recalls for children's necklaces because they've had lead in them, the medallions, and kids put them in their mouth, and really a lot of toys these days too, it sounds like, and some candies and maybe some makeup.
Yes.
Yeah,
yes.
So
unfortunately, yes.
All right. So then I guess that leads to the next question of who should be tested?
Well, children between the ages of 1 and 2 years should definitely be tested, especially if they live in one of the 19 targeted zip codes here in Frederick County. Also, children who are on medical assistance are tested at age 1 and age 2 for a specific examination that medical assistance does require from the child's primary health care provider.
Mm-hmm. Okay, and then so those test results come back. What are the recommendations for what should be done at the various levels?
Okay. The CDC has recently changed their recommendations, and the Childhood Lead Poisoning Prevention Program at the Frederick County Health Department, as you know, we follow CDC recommendations. The new recommendations have targeted levels of lead from 5 deciliters to 9 deciliters of lead in the blood of a child. Children that are tested that have these levels are referred to us at the health department, and we provide education about lead and how to reduce the risk, nutritional counseling with the ladies in WIC if the child is 5 years of age or younger. Like I said, we do teaching, education. We keep a close connection with the primary care office to make sure that the child is being retested according to what the provider is requiring. But the reason that the CDC did change those levels was because children who were tested and did not have a level of 10 micrograms of lead in their blood or less, they sometimes weren't getting those results. The parents weren't getting those results. By changing the recommendations from 5 through 9, the results are being made aware to the parents, and doctors and the parents and we as public health officials can make sure that the child is being case managed or followed to make sure that their lead exposure does not increase and that it does over time decrease.
Mm-hmm. Okay. So you mentioned the test result of 5 to 9,
mm-hmm.
what you do to try to help follow them and make sure it doesn't get higher. Right. So how about those children whose blood lead level is 10 or greater?
Okay. Children who have a blood lead level of 10 or higher are automatically enrolled in case management services with us in the lead poisoning prevention program. Those children are, again, their parents or guardians are given education and educational materials, nutritional counseling with WIC, again, if the child is 5 years of age or younger. If the child is 3 years of age or younger and has a blood lead level of 20 or higher, they are referred to the Frederick County Health Department Developmental Center for some screening.
Okay.
Yes.
All right. And then so I know from our talking before this that there are some changes coming in the state of Maryland for the recommendations for who should be tested.
Yes.
You want to talk a little bit about what we expect those changes to be?
Sure. Starting in hopefully January of 2016, there will be universal testing for all children ages 1 and 2 years, starting with the children who were born as of January 1st, 2015. And this is regardless of their zip code that they live in, regardless of their insurance status. And this is being done, again, to find these children who have low levels of lead exposure, so we can find out who they are, and primary care providers can treat them and get those levels down.
Okay. Yes. So that is a big change, but I guess it's recognizing that there are, many sources of lead exposure that parents might not be aware of, and that children move around.
Yes.
Sometimes a lot during their early years when their brain development is really important.
Absolutely.
Okay. So before we close, you want to talk a little bit about how the Frederick County Health Department and the program that you're in will be responding to those changes?
Sure. The Health Department's Childhood Lead Poisoning Prevention Program will be a resource for all of the primary care providers here in the area. And we will pass information on to the primary care providers, and they can, when they see the child, pass that information on to the parents or the guardians. The Maryland Department of the Environment and the Department of Health and Mental Hygiene are planning on setting up hotlines for all of the primary care providers that they can call in directly to DHMH if they have questions or concerns, and they can be addressed that way.
Okay, so we know what we think will probably be coming down the road, maybe as soon as January.
Hopefully as soon as January.
All right. Is there anything else that you'd like to share with our viewers?
If you have any questions or would like to do further research, obviously please go to www.cdc.gov. They have a lead section. And Maryland Department of the Environment.
Okay. Well, very good. Lynn, thank you so much for being on the show and talking about lead so that parents and guardians and child care providers are aware of some of the risks and what to expect at their next regular medical exam for children who are ages 1 and 2.
1 and 2, yes.
Very good. And now please stay tuned for this month's Medical Myths. And now here's this month's Medical Myths. This month's Medical Myths is about suicide from the American Foundation for Suicide Prevention. To understand why people die by suicide and why so many others attempt to take their own lives, it is important to know the facts. The first myth is that suicide can't be prevented. If someone is set on taking their own life, there is nothing that can be done to stop them. Well, the fact is, suicide is preventable. The vast majority of people contemplating suicide don't really want to die. They are seeking an end to intense mental and/or physical pain. Most have a mental illness. Interventions can save lives. The second myth is that people who take their own life are selfish, cowards, weak, or are just looking for attention. Well, the fact is, more than 90% of people who take their own life have at least one, and often more than one, treatable mental illness, such as depression, anxiety, bipolar disorder, schizophrenia, and/or alcohol and substance abuse. With better recognition and treatment, many suicides can be prevented. Another myth is that asking someone if they are thinking about suicide will put the idea in their head and cause them to act on it. Well, the fact is that when you fear someone you know is in crisis or depressed, asking them if they are thinking about suicide can actually help. By giving a person an opportunity to open up and share their troubles, you can help alleviate their pain and find solutions. Another common myth is that teenagers and college students are the most at risk for suicide. Well, the fact is, the suicide rate for this age group is below the national average. Suicide risk increases with age. Currently, the age group with the highest suicide rate in the U.S. and in Frederick is middle-aged men and women between the ages of 45 and 64. The suicide rate is still highest among white men over the age 65. Another myth is that someone making suicidal threats won't really do it, they're just looking for attention. Well, the fact is, those who talk about suicide or express thoughts about wanting to die are at risk for suicide and need your attention. Most people who die by suicide give some indication or warning. Take all threats of suicide seriously, even if you think they are just crying for help. A cry for help is a cry for help, so help. The final myth is talk therapy and/or medications don't work. Well, the fact is, treatment can work. One of the best ways to prevent suicide is by getting treatment for mental illnesses such as depression, bipolar illness, and/or substance abuse, and learning ways to solve problems. Finding the best treatment can take some time, and the right treatment can greatly reduce risk of suicide. In fact, it can bring you back your life. For more information about local resources, please dial 211 to reach the Mental Health Association's resource line. That's this month's Medical Myths. And now, here is this month's health tip with Amber Nally.
Hello, this is Amber Nally, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Childhood Lead Poisoning Prevention Program of the Community Health Services Division. The holiday season is here, and that means many children will be given toys as gifts. Since new toys are a holiday tradition, parents should be aware of possible lead hazards associated with some toys, including toy jewelry. Review these important facts to keep your children safe this holiday season. Lead is invisible to the naked eye and has no smell. Children can be exposed to it through normal hand-to-mouth activity just by handling their toys. Lead may be found in the paint on toys. Lead was banned in house paint on products marketed to children and in dishes and cookware in the United States in 1978. But lead is still used in other countries and can be found on imported toys. The use of lead in plastic has not been banned. Lead softens plastic to make it more flexible so it can go back to its original shape. However, when the plastic is exposed to sunlight, air, and detergents, the plastic breaks down and may form lead dust. If you think your child has swallowed or put lead jewelry in their mouth, or if you suspect your child has put a toy containing lead into their mouth, remove the toy and see your healthcare provider. For more information on lead, go to the CDC website. If you have questions about your child's possible lead exposure from toys or would like more information on toy recalls, please see the Consumer Product Safety Commission website. For more information on childhood lead poisoning prevention, please contact the Maternal Child Health Program. Thank you for tuning in to this month's health tip.